Yes. So here is your card, Keval Shah. Keval Shah, here is your card. Can you hear me, Yashodhara, now? So, view full screen. So here is your card, Keval Shah. Keval Shah, here is your card. Can you hear me, Yashodhara, now? So, next speaking, Jay Lakshmi or Yashodhara or Rupa Rani, Purnika, according to the order. So first Jay Lakshmi, then Yashodhara, then Rupa Rani. In this order, anybody is there? Okay, then I will take according to them. Yeah. So yeah. Hide floating meeting controls. Yes, Dr. Keval, here is your card. My card is on the tab. So are you ready, Keval? Keval, are you ready? I think you got muted, right? Yeah. Keval Shah.
Yes, sir.
Yeah. Get ready. Once you are ready, you can start.
Okay, sir. Good morning. I am Dr. Keval.
Good morning, doctor.
So, how may I help you today?
Doctor, I am worried about my daughter.
Okay.
Actually, I am visiting Australia. I'm quite upset because, 2 hours ago, my 5-year-old daughter was bitten on the face by a dog owned by the friends, I'm staying with. I washed the wound, but it's worrying me too much. My daughter, she's just, you know, very small. She's just 5 years old.
Okay. I am sorry to hear that your daughter had to go through all this. So, before proceeding further, how may I address your daughter?
My daughter's name is Dorothy.
Dorothy. Okay. Thank you for sharing your concerns. First of all, please calm down and there is nothing to worry. Yeah, the bite has already been assessed and the first aid has been given. So, after examination, I can definitely assure you that the wound is only going to need a cleaning and a closure because it is not a very deep bite, but it is just a superficial one around the hairline. So yeah, that is what we are going to do now. Is that okay?
That's absolutely fine, doctor. But the thing is,
Yes.
I am worried. I'm really worried about the circumstances of the bite, What happened? And the doctor, how are you going to treat the wound? Can you please tell me in detail?
Yes, definitely. Your concerns are understandable. I'm going to explain you everything. So first of all, as I have already described that the bite is not a deep one, it is just a superficial dog bite. So in this case, I don't think antibiotics are at all necessary. Also, the bite is so superficial that the infections of chances are negligible. So just the recent wound will only need a cleaning and a closure because the wound is on the face. So as the face already has a excellent blood supply, it will recover on its own. There is nothing to be done at the moment, and please do not worry. I hope that you are understanding me.
I am little bit upset about the infection. Dogs eat filthy things, and I don't know. if my daughter will be fine and fit as earlier. I am worried about the infections caused by dog bites.
Yes, I can understand. It's quite natural to act like this when your child is in pain. So I would like to ask some questions about your child immunization status. Shall I?
Yeah, of course, doctor.
Okay. So, uh, do you remember anything about the tetanus immunization status of your child? Please let me know.
Um, I am not sure, doctor. I'm really not sure. Maybe my wife knows about it, but yeah, I'll check it out with her and I'll let you know.
Okay, no problem. Also, as far as your concern for infection you mentioned, the in Australia, Australia is almost free of rabies, and there is nothing to be worried about. And yes, the infection cannot be happened in this case because the bite is on the face, and the face has an excellent blood supply, so it will recover on its own. However, we are already providing the symptomatic treatment, which will provide a relief to your daughter. Definitely, I hope that you are trying to understand me.
Okay,
Yes.
right. And doctor,
Yes.
I am not very much convinced. I'm not happy. I want I want to tell you, there is no need of any medication, I suppose, or antibiotics. What do you think, doctor?
Yeah, at the moment, I don't think that there is any need for medication. Just I would like to advise you few things, if you allow me.
But I think because this is infection, I heard my relatives telling me whenever dogs bite, there are some injections that should be taken, like 14 injections in India. So maybe some sort of antibiotics are needed, I think.
Yes, according to the recent statistics, Australia is almost free of rabies, and the infection that you are talking about is definitely rabies, which is transmitted from the dog bite. But as this bite is very superficial, and also the infection can happen when there is a chance of a deep bite. But I can definitely not see any deep bite your child suffering from. So yeah, just
Why
there are
should why should we take chance, doctor? Why not we give these injections or antibiotics?
at the moment, I don't feel that there is any need for antibiotics. Also, also your child is 5 years old, so definitely I cannot be the authorized person to recommend you the antibiotics and the dosage. You will need to be referred to a pediatrician, in my view. So if you want, I can definitely recommend you to a good pediatrician. He can assess you. He can assess your daughter's condition and also can recommend you some appropriate dosage of the antibiotics.
Okay, give me some points how to care for the wound and how to recognize or identify the signs of infection, doctor.
Yeah, just take care of the wound, and it will be, if possible, it will be appreciated that you can visit with your daughter for a review after 48 hours, so that we can see how our wound is progressing or how it's healing. And also, please be constantly in supervision of your child, that she is not going near the dogs, as in the future the dog bite may be severe, and she might need she might need some more stitches too. I hope that we are on the same page.
Yeah, I am very much upset about that incident. I have no experience with dogs. I don't know how my friends, okay, are managing with these dogs and all these things. Normally, my friends told me that their dog loved children, but how come this dog bit my daughter only? I'm a little bit upset.
I'm sorry to hear that you are feeling this way. However, I am going to provide you a pamphlet in which everything is written of what we have discussed so far, and also the contact number is mentioned of this hospital's emergency department. You can definitely visit and contact us anytime if your child's condition is severe or if you notice any signs of further infection. Is that clear?
Yeah, that's very nice, doctor. Thank you very much.
Thank
Is
you.
there anything else that I need to know?
No, at the moment, that's it. Yeah, I am just hoping you to. check your daughter after 48 hours for just a general review. That's it. Take care.
Okay, doctor. Thank you very much. Yeah. So you can mute back. You can mute back. Yeah. So Dr. Keval Shah. Now we have the feedback. Definitely improvement is observed. There is no doubt regarding the improvement that you're presenting in your speaking sessions, role play sessions. But the thing is, um, you said after examination. After examination. So you examine him. So after that particular exam, say you can say after the examination, you can say. So you can use a definite article. After the examination, definite article. Yeah, fine. Next one. Infection cannot be happened. Infection cannot be happened. It's going too far. It's going too far. Infection is impossible. Okay. Or there will not be any infection, or no need to worry about infection. No chances of infection. There are no chances or no signs of infection. So this is how you can talk. Cannot be happen, or infection cannot happen. Okay. Then you said just. So you're repeating the word there. Then that you're dragging again. Some words at the end you're dragging that and like that one. You're dragging still. And next one is that charisma is missing. The charm is missing. That responsibility feeling, that feel of responsibility is missing. Now, what responsibility as a doctor is missing? The responsibility as a student, as an examinee, or as a candidate who is going for the exam, that you are showing. That fear also is there, that panic also is there, that confusion is also there, all these things. Stop thinking that you are a student or an examinee. Forget that this is an examination or OET test, and do not let your mind be boggled with the point that I am the examiner or the teacher. Take the other angle, the other side of the picture. This is a role play. You are the candidate, that means you are a doctor, okay? And I am the patient. Start seeing from this angle. Then only you can do some sort of justice to the role play. That sympathy, sympathetic attitude is missing. I cannot feel that concern of yours on me. I can only see that you're worried about your sentences, you're worried about your grammar, you're worried about your vocabulary, you're worried about your sentence structures, you're worried about the delivery, all these things. So now, if you feel that you are a student, you will become weak because I am the teacher. If you feel that you are an examinee and I will be examiner, then also you will be feeling weak because examiner is stronger than the examinee and teacher is stronger than the student. There are three views here. You can be a doctor, or you can be a student, or you can be an examinee. Examinee means one who is going for the examination. Then there will be an examiner who gives you mark. So examiner is stronger than the examinee. So you are weaker here if you take this angle. Another angle is you are a student and I am a teacher. So student is weaker than the teacher. Teacher is stronger. So again you will be weak. So now the other angle is it's a role play. Remember that it's not an exam, it's a role play. Like that you have to feel. And in this role play, you are a doctor and I am a patient. So patient is weaker than the doctor. So doctor will be stronger. Why don't you focus on this attitude? This is the most vulnerable area that you are treading on. Be very careful. You have to go on the strong area. Okay? Strong ground. But you are going on an area where there is sinking sand or muddy pool. You'll go inside. You will go inside. Sinking sand also you will go inside. Okay. Or muddy pool, mud, full of mud. It will pull you inside. That's all. You will go inside. So both are not fine. So you have to go in the strong area where there is hard rocky area. That rocky area, that strong area is nothing but you're a doctor. And this is a counseling session. Now I am your patient. Remember these things. I've been telling you time and again. Time and again, I'm telling you that forceful attitude is not coming, that powerful attitude is not coming, that sense of concern towards the patient, that responsibility, that empathy or sympathy or whatever you call those, I'm not able to feel in your speaking sessions. You're as if a goat is taken to the butchery and you're going to be slaughtered like that, I feel. When will you overcome this fear and feeling? Okay. You're speaking, no doubt you're speaking. But speaking doesn't help you much, right? You will definitely pass. That's no doubt regarding that. You will definitely pass. But the thing is, how you are going to overcome this Achilles heel. That means vulnerable spot, weak area. So turn your table, see this side, not this side. That's what I mean to say. Yes. Now, Keval Shah, you can unmute.
Yes, sir.
Yeah. Do you have any questions to ask?
No, sir. It's clear.
Okay. I
Yes.
don't know what you are going to do. That feeling, there is no smile on your face. There is no smile. I can see your face, sir. I can read your face. I can test whether there is smile on your face or not. Your lips, sir. There is no smile dancing on your lips. There is only some worry, tension. I have to finish. I have to do this. I have to do well, like that one. That sort of anxiety is overtaking your, performance. So the power, the quality is reduced because of that. So you will never get A grade if you do like that. You will never get A grade. And I'm expecting A grade or at least B plus for you. So do your best next time.
Okay,
Okay,
sir.
fine. I've taken your letter for correction. I'll correct and I'll send you like how I sent Vasundharas. Now you have to, so speaking is done for, speaking is done. Yeah, Keval Shah speaking is done. Yes. Next, I want you to do one listening. I want you to do one reading. And I want you to do one writing. Writing, I'll correct what you have sent, but today also, I want you to do one writing. So whenever you are free, go. Other sessions, when I'm giving the sessions or correcting lecture sessions or writing lectures, you come and join. Okay. So I'll put it in the group, no problem. You can always come and join. But now, speaking is done for you. Next one, Jay Lakshmi. Is Jay Lakshmi there? No. Yashodhara. Yashodhara, can you do your speaking now? I have sent the card already. Can you check it out, Yashodhara? Unmute. Yashodhara 1, Yashodhara 2, Yashodhara 3. Okay, next is Rupa Rani. Rupa Rani, are you ready for the speaking session? I gave the card already in the group. Are you ready? Then you can message me on WhatsApp. Rupa Rani 1. Or you can, no, sir. Okay, fine. Thank you. You can message like that. Afterwards, you can do. Next one is Purnika. Purnika is not there. Next one is Susmita Dasi. Hello, Susmita Dasi. Are you ready for a speaking session? I gave the card already. Susmita Dasi. Susmita Dasi. Are you available? Yeah, Susmita Dasi. 1. Susmita Dasi 2. Susmita Dasi 3. Okay, next one. Grishma Shankar. Are you available, Grishma?
Yes, sir.
Yes, that's it. Get ready. You have prepared the card, right?
No, sir, I didn't prepare.
Okay, no
Now I will
problem. You can prepare now. I have already sent the card in the group, speaking group.
Okay.
So I will send you again personally. Okay. Right. So this is the card, asthma. Okay. And the card is here again. Yeah. Yeah, next, who wants to do the speaking session? You can tell me. Farzana, Isa Suleiman, Farzana. Yeah, Farzana is, yeah, writing is there. Yeah, Farzana, I'll correct this later. Okay. Yeah, very nice picture. Yeah, Yashodhara. So, where is this Susmita? Okay. Not Susmita. Susmita or Grishma? Who is that one? Who said yes? Who is on the line now? Who is that? Grishma, right? Susmita or Grishma? Grishma, yeah. Grishma, get ready. I'm sending you the card. Okay, this is the nursing card. This is the nursing card. Forward. Yeah, get ready. So, Grishma, 1 minute. Come on. Grishma. Grishma. Greshma. Grishma. Yeah. So Grishma Shankaram, I sent you. Prepare for 3 minutes. Prepare for 3 minutes. Yeah, this is the card. Aisa Suleiman Farzana Khan. Farzana Khan, do you want to do the speaking session next?
Yes, sir.
Okay, the same card, okay? The
Yeah,
same
yeah.
card is here. You can also prepare immediately after her. I'll take for you.
All right.
So view full screen mode. Yeah, I'll send you also personally on the WhatsApp. Yeah.